My ethical topic that I'll be talking about today is managing conflicts of interest. So, for a little bit of background, incentives can have an effect on physician-patient relationships due to speculation and dishonesty. Patients may feel that because of incentives, their physician is withholding information or procedures in order to meet requirements to receive their payout. Patients may also feel pressured with changing their plan of care because of how the pay-for-performance incentive program works. This gives patients a loss of sense of control, which affects their will to cooperate in the future. Lastly, physicians can enroll too many patients. More patients means that the opportunities for incentives increase, but also means there's an increased risk of burnout leading to negligent patient care. Significance. Why does this topic matter? There are 11 different types of incentives, some of which are quality bonuses, quality grants, and performing profiling that physicians can receive. The one I will be discussing specifically is a value-based incentive, pay for performance. Pay for performance works by using a cycle of develop, implement, evaluate, adjust, and redeploy. Centers of Medicare and Medicaid Services is the largest funder of pay for performance, contributing to 40% of their funds. And according to the American Medical Association, 59.1% of physicians received some sort of revenue from a pay-for-performance program. And my thesis for my paper is incentives impose a risk on medical ethics because major ethical subjects of autonomy, beneficence, and non-maleficence can all be manipulated into something dangerous and harmful. Ethical principles in conflict. The ethical principles in conflict are beneficence and non-maleficence versus utility. For beneficence and non-maleficence, a physician should be putting a patient's needs of health care before their own personal needs of financial gain. Physicians should also not harm their patients by withholding information or procedures in order to meet requirements of their own incentive. In contrast, utility focuses on the consequences of someone's actions and not the action itself. In this case, withholding a possible diagnostic procedure such as a simple, complete blood count may not seem extremely significant, but can cause detrimental damage if there was something missed. Laws, codes, and duties. For my laws, codes, and duties, there is the Civil Monetary Penalties Law, also known as the Civil Monetary Statute. This keeps physicians accountable so that there is no information withheld from the patient. It does this by allowing the Secretary of Health and Human Services to impose civil money penalties for forms of fraud and abuse involving patients who are paying for their treatment using Medicare and Medicaid programs. Penalties for the Civil Monetary Penalties Law range from $2,000 to $100,000 based on the type of violation. Some examples for being penalized would be presenting a claim that the person knows or should know is for an item or service that was not provided as claimed or is false or fraudulent. The next example would be providing false or misleading information expected to influence a decision for discharge. And lastly, violating the Stark and anti-kickback law also results in penalization. Stark law prohibits individuals from referring Medicare or Medicaid patients for designated health services to individuals who have a direct or indirect financial relationship unless an exception applies. Meanwhile, the anti-kickback law prohibits individuals from asking or for receiving any remuneration in exchange for referrals of federal health care program businesses. These two laws go hand in hand to prevent 1. Utilization of medical services, 2. Increasing program costs for Medicare and Medicaid, 3. Poor medical decision-making, and 4. Unfair competition. Solutions for the future in conclusion. Solutions for the future should be, because quality of care is difficult to measure, doctors should have goals for their patient before admission and have to meet those goals in a set time frame. The goals should be something measurable, like improving lab results and vitals or therapeutic effects of a medication in order for a physician to receive their incentive. Lastly, transparency between a physician and a patient is crucial to maintain a trusting relationship. Physicians should be upfront with their patients, at their first consult, about the future of an evolving care plan. This way, patients are not surprised or feel as if they are being pressured into changing their regimens and will feel a sense of security that their physician truly supports them and their own health. In conclusion, incentives can be beneficial to both the physician and the patient if used correctly. Incentive programs are created to be used as motivation to encourage refining health, but can be used in a manner that can lead to unreliability and distress. Therefore, communicating to patients what the full intent of their care is going to look like moving forward and ensuring that physicians are righteously executing their work will lead to the non-sinister acts of how incentives should be used. There will always be a conflict of interest involving incentives in the medical field, but finding ways to stiffen rules so that there are less loopholes will be the most effective and promising for patients.